24-year-old Ashley Stewart has spent most of her life on drugs.
I started using with friends when I was young, about 11. I started using with people a lot older than me because, that's what they were doing. That's the clique I was hanging out with.
In her teens, Stewart stopped the drug use a couple of times, but always went back to opioids.
I used Percocets for about 4 or 5 years. And then when that became too expensive, I switched to heroin. And I lost, my storage unit, my car, my house. I lost it all.
And your job.
And my job.
With that loss, Stewart finally sought help at the Johns Hopkins Broadway Center for Addiction, where she goes for buprenorphine treatments and gets extensive counseling. Dr. Kenneth Stoller is the director here.
This is something that fortunately can be treated very successfully with combinations of medications as well as psychosocial counseling and case management.
But first, Dr. Stoller says the public, law enforcement, and the medical community have to change the way they think about addiction and realize it is a medical disorder.
There are over 100 medications that can be used for the treatment of hypertension. There's only 3 medications for the use of for opioid treatment, and unfortunately, we still have a gap in terms of who's using it.
The 3 drugs: methadone, buprenorphine, and naltrexone. Methadone has to be administered in a clinical setting. Buprenorphine can now be implanted under the skin, or a doctor can write a prescription for it. The problem is, not enough doctors have the needed training to prescribe it, and the government has strict guidelines on how many people a doctor can treat at once. And there's the opiate blocker naltrexone, a long-acting injection lasting 30 days. Stewart says taking buprenorphine helps her do the work of recovery.
It helps me to keep my structure in line, helps me from getting sick, it helps me to function as a normal human being.
When she lost everything, Stewart had no place to go. She was able to get into this group home, which is part of Dr. Stoller's program at Johns Hopkins, and it gives her counseling, a roof over her head, and structure. Anise Bailey Jackson is the residential counselor for the group home.
No matter how bad things get, if you have someplace to come, call home, and someplace to come, you learn that, okay, I don't have to be out there by myself. I have somebody that worries about me.
So far, Stewart says the medication, counseling, and group home give her hope that she can change her life.
I'm able to actually proceed with the life that I've always imagined I'd have.
Which is?
Which is having a nice job and a big house and a family and a dog.
Lisa Robinson, WBAL TV 11 News.
Now, Lisa says Ashley left the group home back in October, and as far as we know, she is still doing well.